So you can see on top that you have the number of STDs in a community. They will be either symptomatic or asymptomatic. And as we stated in the beginning, most are asymptomatic. So some of these people would be in contact with the health service if they're symptomatic. They may or may not be in contact with the health service if they're asymptomatic. That some women will come in for screening, most men do not. But if they are in contact with the health service, you can see that they may or may not have a diagnostic procedure initiated. Some clinicians just treat on the basis of symptoms and never do a test, and that would be called empiric prescription of an antibiotic. So if they did have a correct procedure done and get that diagnosis, then hopefully they would get some efficacious treatment that the doctor would provide for them. So this would give you the number of people who were maybe cured in the community. However, we also have to worry about notifying the partners so that they don't get reinfected from their partners. But over on the right-hand side of the screen, where you see most people who have STIs are asymptomatic. And so they are not in contact with the health service. And so they're probably not cured unless they're screened or unless we go into the community outside of the STD clinic with an outreach type of screening in an emergency department or in a van or at a health fair or in a pharmacy. So these are the people that we really are hoping that our new diagnostics, which can be point of care, would reach so that we would have more people in the community cured of their sexually transmitted infections. So in summary, we talk about the new molecular tests for CT and GC, chlamydia and gonorrhea. The older NATs appear to have a good sensitivity and specificity compared with those older traditional tests. We're now moving to amplified tests that are point of care. So we know that it's important to screen and test symptomatic patients, but not only those, but we need to screen asymptomatic people who don't have symptoms. These point-of-care tests are becoming important for immediate treatment, and willingness to wait is important. You have to have the result while the patient is willing to wait to get his result. Expense is an issue. Sometimes these assays are a little bit more expensive than the large assays that are done on the big platforms. But we do know that cost-effectiveness analyses can guide choices. And there are even some models coming out now saying that if we have a point-of-care test that can be done that is effective and is accurate, that we can actually have an impact on the epidemic that we are having for STIs. So we do know that NATs allow for non-invasive specimens in non-traditional venues. Thank you very much for listening to our talk today to get some ideas about how we can diagnose chlamydia and gonorrhea in this day and age.